Did you know that, according to statistics, Nigeria records about 1,047 maternal deaths per 100,000 live births? This means that 1 in every 96 women dies. Remember, this is based on available data. When you consider unknown cases and unrecorded cases, the number may actually be higher than this by a distance. In this video, I will tell you the 4 most common reasons why some women experience sudden deaths days after a C-section, and how you can prevent this from happening. I decided to make this video because recently, on this social media space, I've seen a few young women who died suddenly after childbirth through C-sections. I know some persons in the past who lost their lives from complications arising from childbirth, and I think most people know someone or know someone who knows someone that died from complications from childbirth, especially after C-sections. This is not to create any fear in you or cause you to panic. This is simply for knowledge and awareness purposes. While the major causes of deaths are primarily due to lack of basic hospital infrastructure, poverty, and delays in emergency situations, however, ignorance in the part of doctors and patients nevertheless play a fundamental role in why many women lose their lives post C-section. Please, this video is just for information purposes only. This is not a medical advice or prognosis. There are 4 main causes of death in women after caesarean section. The 4th one is the most dangerous of all because it can kill you instantly. However, it is also the one that is most preventable. So make sure you listen to the end because you might just be saving a life. One of the reasons or one of the causes why some women die after childbirth through C-section is called preeclampsia. Preeclampsia simply refers to pregnancy-induced hypertension. It is a dangerously high blood pressure associated with some pregnancies. It does not always resolve when the baby is born. It can even develop or worsen up to 6 weeks post-delivery. When the blood pressure is so high, it can lead to stroke, heart attack, or a condition called cardiomyopathy, which leads to postpartum heart failure. The second one is sepsis. This is a severe infection which originates from cutting through the abdomen and uterus. If this infection is not treated, it can progress to sepsis, which causes organ failure. The third one is what is called postpartum hemorrhage. This happens when the uterus fails to contract, that is, when it fails to start going back to its normal size after surgery. It can also be caused if there is a tear in the uterus, which is called a uterine rupture, or when a portion of the placenta is left behind. This type of bleeding can start days after the surgery, and because it is internal, the woman might not see any blood flow outside, making it difficult to spot until she goes into shock. All these ones I've mentioned so far, that's these 3 so far, can give you some signs like headaches, heavy vaginal bleeding, fever. But you see, this last one, it does not give you any sign most times. It starts suddenly and can kill you instantly. The good thing about it is that it is very preventable. It is called pulmonary embolism. Pulmonary embolism is also called a blood clot. This is when your blood forms something like a gel within your blood vessels that blocks your blood flowing to vital organs, leading to sudden death. Pregnancy naturally increases your blood clotting ability to prevent bleeding during birth. However, due to abdominal surgery and a period of immobility, that is staying in one place after surgery, you develop a higher risk of blood clots in your legs, which is called deep vein thrombosis. If this blood clot develops in your legs and mistakenly breaks free, it can travel to your lungs and block blood flow to your lungs, which can kill you instantly if not treated immediately. You can help yourself prevent blood clots forming after C-section by doing all of these. Number 1, early mobilization. Get up and move. Take short walks within hours after your surgery. Ask the hospital staff or relatives to support you. This is the single most important step in preventing pulmonary embolism. 2. Mechanical devices. Ask for compression stockings or anti-embolism stockings and wear them on your legs. This helps improve blood flow and prevent blood from pooling in your legs. You must wear these compression stockings for 7 to 10 days minimum. Sometimes you have to wear it for up to 6 weeks depending on your specific risk factors. Please note the words risk factors because I'll come back to it shortly. 3. Anticoagulants. Your doctors may prescribe anticoagulant injections during recovery if you are moderate to high risk. Anticoagulant injections are injections that help thin your blood so that it does not start clotting. 4. Avoid smoking. Quitting smoking is strongly advised because it damages blood vessels and increases your chances of developing blood clots. Now remember, I asked you to take note of the words risk factors. The number of days you need to wear compression stockings and if your doctor will prescribe anticoagulants to you depends on your risk factors. Risk factors in this circumstance refers to already existing health conditions that would make you more likely to develop pulmonary embolism after C-section. Unfortunately, in developing and underdeveloped countries like Nigeria, most people do not know their health history and do not even know if they have any underlying conditions. So doctors don't even know whether to put you on anticoagulants or not, or whether to ask you to wear compression stockings for an extended period of time or not. However, if you have any of these or have had any of these, you may consider yourself as a risk factor and must inform your doctor before your C-section. Number 1, previous history of blood clots. Number 2, genetic blood clotting disorders. Number 3, medical conditions like heart diseases, sickle cell disease, or cancer. Number 4, emergency C-section. Number 5, complicated labor. 6, preeclampsia. 7, excessive bleeding. 8, multiple pregnancy. That is, if you are carrying twins, triplets, etc. 9, high BMI. That is, if you are obese. 10, advanced maternal age. That is, if your age is 35 years and above. 11, immobility. This is prolonged bed rest or inability to move around for several days. And 12, smoking, if you are a smoker. There are certain critical red flags you must look out for in the days following a C-section. Certain symptoms require immediate emergency medical evaluation. These include 1, sudden shortness of breath, chest pain, or a persistent cough. 2, severe and persistent headache that never gets better or goes away, or blurry vision. 3, swelling, redness, or severe pain in one of your legs. 4, heavy vaginal bleeding. This is defined as soaking a pad in an hour or passing large clots. 5, a fever of over 38 degrees Celsius or a foul-smelling discharge. Please share this to your friends, family, and loved ones. You don't know whose life you may be saving. Thank you for listening.